Good evening. A consultant says he fears changes to paediatric care at Eastbourne Hospital will compromise children's health care.
Eastbourne District General wants to move its short-stay paediatric assessment unit to a different building and change staffing and opening hours. The local NHS trust says the service will be better, but one doctor has told us he believes more young patients will end up being sent to Hastings for treatment instead. Here's Malcolm Shaw.
The short-stay paediatric assessment unit at Eastbourne District General Hospital sees 3 to 4 children a day. Now the NHS trust which runs the hospital wants to move the unit next to the emergency department and increase its opening hours from 5 days to 7.
Families will appreciate that 10 hours a day, 5 days a week really doesn't respond to the emergency needs of children in Eastbourne, because children can't work the weekend, later on in the evening, and that service doesn't really work for them when they need it. So what we are doing is moving our paediatric expertise to A&E to work alongside our colleagues in A&E, so that children who come to Eastbourne A&E have near immediate access to paediatric expertise if they require it.
But the change would also see the current staffing of 1 consultant, a junior doctor and nurses replaced by what's called advanced paediatric nurse practitioners. That's a matter of concern for Dr. Keith Brent, who's worked in East Sussex for 20 years. He says the plan will mean more young patients having to go to the Conquest Hospital in Hastings for treatment.
I think it will markedly reduce the quality of care that we can provide. The main way it will reduce that is by reducing access to paediatric care. So children, young people, families will have to, in my view, a significant number will have to travel much further. A significant number will need to go to Conquest, who can currently be managed at Eastbourne.
The trust denies more children will have to travel to Hastings and says the nurse practitioners will be highly trained, but local politicians are calling for more consultation over the plan.
What local clinicians are saying to me and to others are that these proposals are half-baked and that they are happening or rolling out far too quickly. The 8th of January is when they're set to come in, yet all of the necessary preparations don't seem to be in place. There needs to be a pause so that all of this stuff can be sorted out.